Climate scientist at the Kwame Nkrumah University of Science and Technology has developed a model to predict meningitis outbreak using relative humidity as proxy. Dr. Isaac Tetter of the Environmental Science Department says absence of data inspired him and his team to embark on a search for ways to foresee occurrence at least 9 months in advance. He says the model will enhance government's efforts to fight the perennial disease, which has already killed over 40 people in the Upper West region this year. Prince Apia with more.
Meningitis is a bacterial infection associated with several environmental factors such as dusty harmattan winds and low humidity. Over the years, the disease has killed many people, especially in northern Ghana. According to the Ghana Health Service, at least 409 cases of meningitis have been recorded as at April this year, killing over 40 people. Dr. Isaac Tetter is lead researcher.
The constraints that we have on meningitis data analysis is that we don't have much data across the country and even globally. So what we intend to do as environmentalists or climate scientists is to find proxies for meningitis. And proxies are surrogates. So in place of meningitis data, what environmental variable can you use to make your prediction? Relative humidity and meningitis relate in an inverse relationship. Wherever we have high relative humidity, it is expected that we have low meningitis. And wherever we have low meningitis, we also have high relative humidity and vice versa. So with this situation, then we are using relative humidity as a proxy for meningitis, so that once you don't have data on meningitis, we can simply use relative humidity variability in the atmosphere to predict the onset of meningitis and where the disease is likely to occur.
The government and its partners engaged in vaccination outreach can fully utilize the model to target communities with high risk of meningitis. Dr. Tetter says the model is essential for planning purposes because it can predict meningitis occurrence at least 9 months in advance.
In fact, it is seasonal or yearly. So what research can do to augment whatever strategies the government is doing is to make prediction a season ahead of time, because it needs time to organize yourself in logistics and so on and so forth. And therefore, what we can do is we are currently in 2020, so we want to see the climate outlook in 2021. Nobody is there, but we can use this modeling approach to make a prediction of the state of the relative humidity in 2021. If we are able to spot areas that are having low relative humidities, it is anticipated that these are the regions that will be vulnerable to the disease. So once you make that information ahead of time, then the Ministry of Health, in consultation with other stakeholders, will start planning for the episode ahead of time instead of waiting till last minute and it takes everyone by surprise.
Meanwhile, Dr. Tetter says more resources are needed to support research such as this to address environmental challenges. The scientist says the department is ready to collaborate with relevant state agencies to adopt and apply the model to put health authorities ahead of the disease. Prince Apia reporting.